You have reached to the most important part of this course, which is diabetes self-management education support. So because diabetes is a chronic disease, it is very important that the patients know about their disease and also how to manage the diabetes mellitus. The American Diabetes Association recommends that diabetic patients receive diabetes self-management education support at the diagnosis and as needed thereafter. Diabetic self-management education support, which we will abbreviate it as DSME, it facilitates the skill, the knowledge, and the ability necessary for diabetes self-care. DSME is designed to address the patient's self-belief, cultural needs, current knowledge, physical limitations, emotional concern, financial status of the patient, medical history, and the health literacy and numeracy of the patient, and other factors that influence each person's ability to meet the challenges of self-management. Diabetic self-management education is to improve the patient's experience of care and education, to improve the health of population and the individual, and to reduce the diabetes-related healthcare costs. There are some critical times to provide self-management education and support, which are when the patient is newly diagnosed with type 2 diabetes mellitus for health maintenance and to prevent the complications, when there is new complicating factors, or when transitions in care occurs, like a change of treatment or pregnancy. There are four key elements of diabetic self-management education support, which are engagement, information sharing, behavioral and psychological support, and integration with other therapies. First of all, we respond to the patient's questions, and we focus on the patient's decision and the reason for that decision, about the strengths and challenges of the patient. We use shared decision making and patient-centered care at each visit. We engage the patient in a dialogue about self-management success, like how they are going with their diabetic management, their concerns, their struggles. Also, we engage the patient in a dialogue about therapy and management. Also, we engage the patient in a dialogue about therapy and a change in the treatment. We also support the patient identifying solutions. It is also important to provide education to the patient's family and or the caregivers. The second step is that we share information. By determining what the patient needs to make decisions about daily self-management, we discussed that diabetic self-management support is an important step in diabetes management. Also described that the DSME support is required throughout life cycle. We shall avoid being didactic and sharing a lot of educational information. We shall provide only the need to know information and avoid to talk all about diabetes, and also to talk about what diabetes is, how it becomes, what is the physiology, what is the part of physiology, because the patients, they are not in the maybe they are in the healthcare science, and it is not very important that they shall know all the mechanisms and all of that. But the important things that will affect their management shall be discussed on, so that this information they remain in their minds and they remember. We shall also review with the patient that the medications can change over time. Take advantage of the teachable moments and provide information that are specific to the patient and their treatment. The third step of DSME support is the psychological and behavioral support. We shall address the emotional and psychological concern of the patient, such as diabetes-related stress or depression. We shall talk to the patient that these emotions are very common, and that anything like stress can increase the blood glucose level and also the blood pressure. Also, we shall discuss with the patient that diabetes self-management is a challenging process, but also it worth the effort. We shall support the patient's self-confidence with this diabetic self-management process. We shall identify if the patient has any problems related to diabetes self-management. And we shall also develop strategies to solve those problems. Also, we shall remind the patients that it takes at least 2 months to change a habit or to apply a behavior. Also, the family and the caregivers should be included into a support system, and they should also be educated. If there are any online resource or anything that will help them with this diabetes self-management process, we shall refer it to the patient and to the family member. The last step of DSME support is the integration with other therapies. Here we shall make sure that the patient has an access to medical nutrition therapy. We shall also recommend additional referrals for medication management, physical therapy, and also behavioral therapy. We shall address the limitations for diabetes self-management activity. We shall also advocate for easy access to social service programs. We shall identify resources and that support the implementation of these therapies. We shall understand the primary care target, provide a treatment target, and also explain to the patient about the target of their medications. We shall also use evidence-based decision support and a performance data to identify opportunities for improvement. That was all for DSME support. All of these guidelines will be available as an article in the references.